To continue to assess your knowledge on skin conditions in session 3, I asked you to answer the questions regarding hyperpigmentation. In this presentation, we will go over those questions. Hello, I'm Pamela Springer. This is the fourth session of Mastering Diversity in Skincare. At the end of the session, be sure to download the file Important Guidelines when Managing Hyperpigmentation. Okay, let's get started. The first question is, if the clinical presentation shows tan patches on the surface of the skin, what layer of the skin would the macules or patches reside? Well, the answer is epidermis. The next question is, what other causative factors may be responsible for hyperpigmentation besides a genetic disposition? Well, sun exposure, because during the process of protection, the melanocytes, which is the pigment producing cell, secretes more melanin pigment in response to the sun exposure. With time, the melanocyte in a certain area of our body produce a huge amount of melanin pigment, and these pigments become accumulated in certain regions of the body, and the dark colored spots are noticed after a severe accumulation of that melanin. Hormonal changes. The hormonal etiology is regarded as the major cause of hyperpigmentation in pregnant women. This type of change is due to increased production of estrogens or increased production of progesterone or melanocyte stimulation hormones. These hormones lead to the stimulation of melanocytes, and the result is an overproduction of melanin. Post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation usually occurs after the eruption of acne, psoriasis, dermatitis, lichen planus, and pyoderma. The post-inflammatory reaction induces melanocytes to secrete melanin, and the overproduction of melanin causes post-inflammatory hyperpigmentation in the form of a temporary darkening. What are the two classifications of hyperpigmentation that assist the practitioner in knowing if the lesions will fade considerably? Well, diffuse hyperpigmentation can result from drugs and also has systemic and neoplastic causes. After eliminating drugs as a cause of diffuse hyperpigmentation, the most common systemic cause is Addison disease. When we speak about focal hyperpigmentation, it is most often post-inflammatory in nature, occurring after an injury, such as a cut or burn, or other causes of inflammation like acne or lupus. Focal hyperpigmentation can also result from neoplastic processes such as lentogens, a melanoma, melasma, freckles, or cafe au lait macules. Acanthosis nigricans causes focal hyperpigmentation, and it presents as a velvety plaque most often on the axillae and posterior neck. What are the three patterns of hyperpigmentation? Number 1, central facial. It involves the forehead, the cheeks, nose, upper lip, and chin. Number 2, malar, involves the nose and the cheeks. Mandibular involves the ramus of the mandible, which is the jawline. What are the two major mechanisms in post-inflammatory hyperpigmentation? Number 1 is the epidermal melanosis. Any inflammatory disease leads to the activity of the prostaglandin and its product. This leads to the stimulation of the melanocytes of the epidermis. The epidermal melanocytes stimulation leads to increased production of melanin and also leads to the increased melanin transfer to the keratinocytes. This process results in epidermal hypermelanosis or hyperpigmentation. When it comes to the dermal melanosis, the inflammatory change damages the basal cell layer of the skin. This leads to increased release of melanin pigment. These melanin pigments are engulfed by macrophages, which is present in the papillary part of the dermal layer. This process is called pigmentary incontinence. For management of hyperpigmentation, what active ingredients would benefit the fading of pigmented lesions? I only asked for you to have 4, but I will go through all of those active ingredients. Azelaic acid is used in the treatment of hyperpigmentation, especially for the treatment of acne vulgaris, which induces post-inflammatory hyperpigmentation. The use of azelaic acids help to reduce the melanin pigment by inhibiting the tyrosinase activity. Also, it has a direct cytotoxic effect on the melanocytes and hence depigments the skin. The next is kojic acid, and that is a special compound derived from a certain type of fungus. This compound also helps to inhibit the activity of tyrosinase, which is the main enzyme needed for the production of melanin pigment from melanocytes. Next, we have topical retinoids. Topical retinoids of different generations are effective against hyperpigmentation. The commonly used retinoids are aldapaline, retinolide, tirazotin, and a third generation retinoids. Topical steroids are helpful in healing the lesion along with hydroquinone. We all know about glycolic acid peels, and they are highly helpful in depigmenting the skin by inducing bleaching effect. TCAs is it's a highly effective peel in treating hyperpigmentation, and this topical, along with cryotherapy, is highly used in fair-skinned people. But the use of cryotherapy is contraindicated in dark-skinned people due to the possible risks of scarring and depigmentation. Aloe vera extract, that contains aloin, which is a depigmenting agent and is highly effective against hyperpigmented lesions of all types. Niacinamide topical application prevents the transfer of melanosomes to keratinocytes and also prevents the melanogenesis. Thus, the depigmentation is achieved. And last but not least is your vitamin C, which is a topical application that's going to stop the tyrosinase activity and also reduces depakonin, which is an important compound in melanin production. What are the 4 early signs of photoaging? The appearance of frown lines on the head, the appearance of fine wrinkles around the mouth and eyes, telangiectasia or spider veins on the nose, cheek, and neck, different pigment skin lesions such as freckles, age spots, and uneven skin tones, a general loss of skin color in the areas exposed to sunlight, taut lips that lose some color and fullness. The skin is leathery and sags. Blood vessels on the nose and cheek are often visible. Lips are reduced in volume. They're pale and thin and lose its definition. They may even be very scaly. Skin on sun-exposed sites may damage very easily. Red, rough, scaly, and crusty spots called actinic, which is sun-related keratosis, may appear. They are very dangerous and are known as precancerous, and therefore the client should be treated according to the standards. Well, those are the answers to the questions. I hope you did well, and I want to remind you to be sure to download the important guidelines for management of hyperpigmentation. And if you have any questions you would like to ask, be sure to join our Facebook group, Don't Be Afraid of the Dark, and write those questions in the comment section. Thank you so much for the time you spent during this presentation, and I look forward to working with you and helping you to grow your business.